And I'd now like to call up Diane Meier and Susie West. Diane Meier, the biographies are in the book. Diane Meier is with the Center to Advance Palliative Care at Mount Sinai in New York. Susie West, the wife of Douglas West, who Diane cared for also before she was in the field of palliative care. We are talking about transformation and what brought her into the field, and from Susie, what it is that was most important to her about the care and how the care changed thanks to the attention of Diane. And I do have to say that I have huge appreciation for both of you for a very long time. Susie, if it's all right, I'm going to start with you. So you're going to have to hold the microphone very close to your mouth, and I keep on forgetting that. Okay. So if you could hold the mic very close to your mouth, I would like you to tell the story of Douglas and his illness and talk a little bit about before Diane came on the scene.
Right. Doug died 21 years ago. I'll be all right. He had Sjogren's syndrome, an autoimmune disease, very unusual to die from, very unusual for males to have. We were at Mount Sinai with many, many wonderful doctors. He was diagnosed with cancer. He was diagnosed, I remember they were sending his blood all over the country to try and diagnose what he had. He hadn't been diagnosed yet. And they all came back, thank you for involving us, but we can't figure this out. When I first really became aware of something, his secretary, what we called secretaries in those days, called me and said, you know, that Doug was in a meeting and he was scratching his legs in front of, I guess, some important people. He was a securities analyst, and he also mentored many young people coming through the system. And from then on, it was one, I would say, from hindsight, one misdiagnosed after another. And he was on prednisone, a lot of prednisone. He had lots of pain. You could not touch him because it's a tissue disease. If you touched him, he felt like it was a sledgehammer coming toward him. So to make the long story shorter, he also had a lot of back pain, and he suffered from osteoporosis. He had kyphosis of the upper back, and we were sent to Dr. Meier, who at that time was studying osteoporosis for pain. And that was the beginning of our journey, which was just 18 months before he died. So he had been through many, many, many doctors, and I did find this was how he, this was before computers, and how he kept his notes every visit, not so much what the diagnosis was, but what they did to him. It's quite amazing, and I did hand it over to the team many, many years ago to show the up-and-coming doctors how, from the view of a patient, how he kept his notes and tried to keep on a line. He worked all those years through this. That was his thing. He had to go to work until the very end. I've skipped a lot, but
so Susie, he had enormous pain. He was bent over. He had back problems. He was in a great deal of discomfort. They found out that it was Sjogren's.
Right. Towards the very end of the disease.
And Diane was a doctor studying bones. And that's the reason why you came into this. You were not in palliative care. There wasn't a field of palliative care.
Diane mentioned it after we got together, and I let it go. I didn't know what she was talking about. And I just wanted her to, continue to help us. So I just, didn't pay much attention to that word.
So tell me, when you got involved, what was it that you focused on, and how did this begin to transform the care of Douglas and transform you in the process?
So again, I want to give a little context, and that is that I am a geriatrician by training, meaning I am a lumper, not a splitter. So the internal medicine training was about, cardiology, oncology, nephrology, and all the smartest people got subspecialty trained when I was coming up. It was only the people who couldn't cut it who stayed in primary care. That was the culture back in the 80s, early 80s. So I had to do something, but I really wasn't comfortable. It didn't make sense to me to give someone a prescription for their heart failure meds and not know if they could afford them or understand what I was saying. I just couldn't. It's just the way my brain was. So I ended up in geriatrics, which had become a field 1 year earlier. Thank God it existed, because there was no alternative. I guess I could have done it. There were no gen med fellowships at that time either. But as a geriatrician, when I moved to Mount Sinai under the storied Robert Butler's Department of Geriatrics, our department was following in the footsteps of the rest of subspecialty medicine in odd ways. So one of the things that he wanted me to do was set up a practice for this disease of the elderly, osteoporosis, bone loss, fracture. And that had been my research as a fellow. And so that's what I did. But I ended up being a splitter again through that work. And when Doug and Susie came to see me, their story was the exemplar of everything that's wrong. I mean, this is 12 different doctors. He was seeing all of them. Nobody had the answer. Everyone was sending him from one specialist to another. And they were like the puck in some ways, being slammed from one end of the court to the next. And no one was really responsible. There was no quarterback. And plus, by the time I saw him, it was too late to prevent his osteoporosis that was due to all those steroids he had had over many years. He was fractured and in a tremendous amount of pain, not only from the bone loss, but also from the autoimmune disease of the Sjogren's. And the other very prominent symptom was fatigue. I mean, I think if you had asked, at the time, if you had asked Doug what was the worst symptom, it was profound fatigue. Yeah. And I just couldn't help I was there as a subspecialist to help him with his bones, right? But I couldn't help myself, literally. So I just, because I saw the gap, and I had to step up. Not because that was my role, because it wasn't.
I remember that Diane after a while, got all the doctors, or most of them, who would come to that session in one room who were treating him. I think it was about a feeding tube that started that conversation, which was highly unusual because no one spoke to anybody.
No one talks to each other. And because there was no electronic medical record, no one even knew what everyone else was thinking.
And I'm sorry, but he was hospitalized many times. He had blood clot in his leg. They took his spleen out. And every time we were in the hospital, and every person who came into that room had to ask his story again. And that drove him crazy. He was adopted also, thinking about genetics and everything. We didn't know anything because he had no idea who his parents were. He happened to be adopted by wonderful people, and he was a wonderful son to them. But that was an issue, that there was no reference, and he was afraid to talk about it. In those days, being adopted was terrible. And one of our doctors, I don't think it was Diane, said, "You must tell your children about being adopted and about this illness." And he did finally. And he was more upset about saying that he was adopted to them than anything else. And they only cared, of course, that he was ill.
So you said something really important that I don't want to have lost on this group, and that's, Diane, you called all of the clinicians together. But Susie knows this because Susie was there. Susie.
I wasn't in that meeting, though.
You weren't
Maybe
in that
today I
meeting?
would have been in that meeting, but then I was not in that meeting.
Okay. And neither was Doug. So were there times where, I know you talk about in the relationship that Diane did much more than most people would do. She came to your home. She held your hand. She held
his
Doug's
hand. She was the only doctor of all these doctors who held his hand, and that was really towards the very. I mean, she held his hand all the time, but coming to the house was at the very end of his life.
So I just want to make draw some important distinctions between Cameron's story and Doug's story. You guys had a diagnosis from the beginning, and you knew exactly what to expect. We had the opposite situation. Complete lack of clarity about what was going on here, and the uncertainty was a key part of the suffering. The not having a label, and then once they got a label of Sjogren's, no one had ever heard of it. So why was Doug so sick? It would have been better if it was cancer, because people would have been able to tell a story around it. It would have made sense. So as I recall talking to Doug about this, that was a huge issue, is that no one understood why he was so sick, so there were implications that maybe he really wasn't that sick, because there was no medical label that gave clear signals to the outside world of why he was so sick. And I was very struck by that at the time, that the lack of the diagnostic label caused tremendous existential and sort of relational distress with the outside world. And I think even for you, like, what is this? You know, there was some frustration with it.
Very often he looked pretty well, and people would say, "Oh, he looks so wonderful," but I knew that wasn't, and I sort of closed myself in. I didn't accept much help. Finally, we had someone, an aide, take care of him, but it was the last month or so, and I had a job, and I did go to that job because it sort of got me away from a little bit from this tragedy that was happening.
So I went from being a subspecialist to becoming a primary care physician in Doug's case. It was just the opposite, because there was nobody quarterbacking, so somebody had to. So so it's interesting how converse our stories are in some ways. Yeah. Yeah. So, but the experience with Doug was like sunlight through a magnifying glass that started a fire in me. I mean, it just aligned everything I had been thinking kind of unconsciously into, got to do this, is what we have to do. And because fortune favors the prepared mind, right at that time is when George Soros and the Robert Wood Johnson Foundation started putting out funding. Had that not happened, I don't know what would have happened. But there were resources to say, I'm going to completely change horses midstream, stop doing what I was doing, start doing this, and I could get funded to do it. But Doug was the catalyst, and Susie.
And Diane has gone on to become, of course, a major force driving forward the field. Susie, you've also been a tour de force. You know, I call palliative care the best friend of the seriously ill, and I live and breathe it every day, and I have been an advocate for it since long before I myself was diagnosed, but it is a part of my care. It is integrated into that care. You have personally changed, and it has changed your role. You're 76 years young. 78 years young.
Excuse me.
Sorry. 21. You're 21. and you are involved in palliative care yourself. Would you mind sharing a little bit?
Sure. Well, after Doug died, which was also around Thanksgiving, which I took from you, I was in publishing, and for a few months I had a job, and then they politely dismissed me. So I was in touch with Diane a lot in those first months. I mean, I was crying all the time. I can remember you came downtown near where I was working to be with me because I just, was uncontrollable. And of course, you were trying to get me to talk to someone, and I refused for a while. And I'm sorry. And then Diane said, "Why don't you come in and into the department and help?" So I sort of said, okay, and I would come in a little bit, not a lot. And then as the time went on, I went more and more, and actually spoke to the head of geriatrics, who was Christine Castle at that time, because I wanted to do something in Doug's memory. And I established a lectureship in his memory and to honor Diane Meier. That was the best thing I ever did at Sinai so far. So every year we have this lecture, and it's going to be the 21st in April. And then I just came to Sinai more and more. I got a desk and a computer and all that wonderful thing. And I still, hold on to that desk as much as I can, because space is crucial there. And I do development. I do whatever I can. I certainly helped Diane open our unit, our palliative care unit, which took a good 10 years or so. Yes. Right. And that's my story, and I'm still there.
So you have been volunteering in support of palliative care since, is it 1996?
Yes.
Since 1996. Another tour de force, and a person who I admire deeply.
And Amy was one of our guest speakers about 3 years ago, I think, for the lecture. Wonderful. So
it's a love affair. So we've talked about meaningful medicine. We've talked about transformation. We've talked about the relationship between the provider and the person and the family. We've talked about meeting needs that are clinical, that often go unmet, and things that are beyond clinical, that are about the existential and even the spiritual needs of an individual and a family, and preparing them. This is the range of what palliative care, what good care for people who are seriously ill offers. And it is the thing that transforms life. I just want to give you the final word on this, Susie. So can you sum up for us the difference before and after the introduction of what we would call palliative care to you and to Douglas?
it was tremendous. I was beside myself most of the time. I went to every doctor with him. Thank goodness. That's why I was let go of my job eventually. Who knows? And but when Diane came and took over, and I remember that very first time we saw her, she gave us her numbers. We could call her. And it's true. I mean, no doctor did that. And it's more prevalent today, but not so much. But, right? And Doug used to say, "I want to call Diana." And I said, "Her name is Diane." It was that kind of thing. And it was just one of these things that just gave us and Doug a relief of someone. And Diane, when she came, I wasn't in the room. And you talked to Doug many, many times, and I still to this day do not know you also got him to talk to each of our children together, and they were. Debbie was pregnant, so with her second child, and I kept saying to Doug, hold on, you know, she's having another baby. And my son was about to graduate. He graduated college. He was about to graduate culinary school. But I would never have done that now after being with palliative care. I would not have put those terrible things in front of him to try and make him hold on. I would never do that again. So it's taught me a great deal, and I, get calls all the time of people who are desperate for help. I just got one before I came here yesterday. Just trying to get access. It's access is a big problem. Yeah.
Thank you both, Susie and Diane.